Welcome, and thank you for joining us today. The USC Family Caregiver Support Center is pleased to provide this educational video for families and relatives who want to learn more about legal and financial planning as they take care of one or more loved ones. Today's topic will address Medi-Cal and in-home supportive services, which is otherwise known as IHSS. I'm Jenny Peterson, and I will be your host for today's program. I'm here today representing the USC Family Caregiver Support Center, which serves and supports family caregivers as they navigate through their caregiving journey. The center provides services such as information and referral, support groups, evidence-based trainings, community education, and much, much more to family caregivers seeking help. We like to think of ourselves as a valuable lifeline and important resource for family caregivers. Our center is also home to the Los Angeles Caregiver Resource Center, which is part of the California statewide system of 11 caregiver resource centers. Now, if you happened upon this video by chance and you don't know about our center yet, please visit our website at www.fcsc.usc.edu for more information. Better yet, you can even sign up for our program right on our website through the yellow CareNav tab on the right-hand side of the page. We know that family caregivers need support, and our center is here for you. Today's presentation will focus on paying for in-home care through the use of Medi-Cal and in-home supportive services, or IHSS. Family caregivers often do not know about IHSS and how it can benefit them. IHSS can be used to offset some of the financial burden of caring for a loved one at home and struggling with loss of income. With us today is Kim Selfon from Betsteck, a nonprofit organization that provides free legal services for low-income individuals. Ms. Selfon is an IHSS and Medi-Cal Policy Specialist, and she is here to talk to us about how Medi-Cal and IHSS can actually work together to help family caregivers pay for care. Kim, take it away.
Thanks, Jenny, for your introduction. I'm happy to be here with you today. My name is Kim Selfon. I'm an advocate at Tzedek Legal Services. And today I'm going to talk to you about in-home supportive services, which is Medi-Cal's home care program, and how to qualify for in-home supportive services and how to ensure that you get the IHSS, the in-home supportive services hours that you need. Next slide, please. So I work for Betsteck Legal Services. Betsteck Legal Services is a legal aid agency. We provide free legal services to people that live in Los Angeles County. We help with all kinds of different things. We've specialized in older adults and disabled adults, and we have a whole array of services to help family caregivers and the people that they're caring for. So we provide help with conservatorships through our conservatorship clinic. They're free for anybody. It doesn't matter what your income is. We provide free legal services. Through our clinic, we help with elder abuse restraining orders from our clinic too. We have an elder abuse restraining order clinic. We assist with financial abuse and other kinds of elder abuse. I specialize in in-home supportive services, which is a home care program through Medi-Cal. I help with Medi-Cal estate planning, trying to figure out if someone would qualify for Medi-Cal. We also do powers of attorney for finances and health and simple wills, along with all kinds of other services. Check out our website at Betsteck, www.betsteck.org, to find out all the kinds of services that we offer. Next slide, please. So today I'm going to talk to you first about Medi-Cal, because in order to get in-home supportive services, IHSS is the name for short. In order to get IHSS, you first have to qualify for Medi-Cal. There is a lot of confusion about Medi-Cal eligibility. The reason there's so much confusion is the program is very, very complicated. So I'm just going to give you a little bit of an overview today about the program. This is in no means to be all-inclusive, just to give you a taste. So I'm going to talk to you about Medi-Cal, specifically non-Magi Medi-Cal. So non-Magi Medi-Cal is a special kind of Medi-Cal for people who have Medicare, people who are over 65 years old, or people that have a Medi-Cal disability determination. So if you're over 65, you would be evaluated for this kind of Medi-Cal. If you have Medicare, you'd be evaluated for this kind of Medi-Cal, and the rules are very different than Magi Medi-Cal, which I'm not going to talk to you about today. Next slide, please. So we do help people qualify for Medi-Cal or advise them if they're eligible. I just want to mention some of the top reasons that people want to enroll in Medi-Cal, according to me and what I've seen. Medi-Cal offers prescription drug coverage. Medicare also has prescription drug coverage, but sometimes the copays are high or there's a donut hole in Medicare. If someone's in Medi-Cal, the copays for prescription drugs are very low, like $1 to $5 a month, and there's no donut hole. So that's a great benefit. Medi-Cal also offers free medical supplies and diapers, which can be quite a cost for households over a period of time. One of the top reasons that people want to enroll in Medi-Cal is to pay for long-term care in a nursing home. So many people go to Medi-Cal planning attorneys to see if they'll qualify or help them qualify for long-term care in a nursing home. And the final reason, the reason that I help most people access Medi-Cal, is so that people can enroll in in-home supportive services, which is Medi-Cal's home care program. And I'm going to talk a lot more about that later. Next slide. So for the kind of Medi-Cal I'm talking about today, non-Magi Medi-Cal, I want to give you just a little bit of information about eligibility. So this kind of Medi-Cal, there is no income limit, okay? No income limit. Many people mistakenly believe that Medi-Cal has an income limit. For this kind of Medi-Cal, there is no income limit, okay? However, there is an asset test. So that means people are limited in how much countable assets they can have. So for an individual, the person must have less than $2,000 in countable assets. That's very low, less than $2,000 in countable assets. What are countable assets? Bank accounts, savings accounts, CD accounts, brokerage accounts, anything that can be liquidated, generally for money. Also property. Someone has an extra property, that would be an asset. For married couples, the couple must have $3,000 in countable assets, under $3,000 in countable assets to qualify for Medi-Cal. Okay. There are special rules called Medi-Cal Spousal Protection Rules, and these special rules allow married couples to have up to $130,380 in countable assets if one spouse in that couple needs nursing facility level care. So you can see there's a big difference. I just told you married couples must have less than $3,000 in countable assets, except there's an exception to that rule. So certain married couples, when one spouse needs nursing facility level care, can have up to $130,380 in countable assets. And I'll talk a little bit more about that. There are some assets that Medi-Cal does not count. These are some of them. There's a larger list, but Most people wonder, can I qualify for Medi-Cal and have a home? Yes. The home does not count for Medi-Cal eligibility purposes. Someone can have $1 million home and own it without a mortgage and still qualify for Medi-Cal. Okay? So the home does not count. One home, it's either the home you live in, or maybe you lived in your home and then you had to move in with a family member for care. That home is still exempt even if you're not living in it. Also, work-related retirement plans are exempt if they're paying out principal and interest. So someone could have $100,000 in a retirement account, and if that account is paying out periodic disbursements of principal and interest, then the $100,000 is exempt. So retirement plans can be exempt as a countable asset for Medi-Cal. So many people get incorrect information about Medi-Cal and therefore they don't apply. So I want to just give you an idea about the ballpark of what people need to qualify for Medi-Cal. Next slide. So I talked a little bit about the Medi-Cal spousal protection rules. They're also called Medi-Cal spousal impoverishment rules, but I don't like that because it sounds like the spouse is going to have to impoverish themselves. It actually protects the well spouse by allowing the well spouse to keep up to $130,380 in countable income, accountable assets, while the ill spouse can qualify for Medi-Cal. So if the ill spouse needs nursing facility level care, but wants to stay at home, they can use these special spousal protection rules. Unfortunately, the rules are pretty, I won't even say they're that new. They've been around since 2014, but a lot of times when people contact the Medi-Cal office, the eligibility workers at the office are not familiar with these rules. People may even apply for Medi-Cal and want to use these rules, but the Medi-Cal denies them because they're not applying these special rules. So sometimes it's hard to get approved with these rules. If you want to find out if you're potentially eligible for Medi-Cal using these rules, please give us a call. We're happy to speak to you. If you applied for Medi-Cal and you were denied because you were over asset, contact us. If you had under 130,000, you can even get enrolled in Medi-Cal retroactively back to 2014 and even get a lot of your home care expenses paid if you qualified back to 2014. Again, to use these special rules, the couple must be married and one person must need nursing facility level care, but stayed at home. Doesn't mean they went to a nursing home. They just stayed at home and they needed help with activities of daily living, like bathing and dressing or walking. A doctor would certify that that individual needs nursing facility level care, just writes a letter, and that's how they qualify for this program. So it's a fantastic program. It's underutilized. It allows people to stay in their home, get home care through in-home supportive services, and access all those other Medi-Cal benefits I was talking about. So that's actually my direct number there. So if you want to give me a call, feel free to do so. Remember, it's just me and my colleague Gail Tamler, and we serve the whole county of Los Angeles. So call us. If you leave a message, we will call you back, but it may just take a little while. Okay, next slide, please. Okay, so we talked about Medi-Cal eligibility. Like I said, first you have to qualify for Medi-Cal before you can qualify for in-home supportive services. I just wanted to add a little artwork to this presentation. This is a wonderful painting by an artist named Vanessa Castro. That's her website. She does lots of bright, colorful art of superheroes, and she's a person who uses a wheelchair to ambulate, and she has some great books about kids' books about people with disability or being a kid with disability. So check out her website. She's wonderful. And I wanted to just use this to illustrate that knowledge equals power and strength. Knowing about Medi-Cal, knowing about in-home supportive services, how benefits are calculated, you will be able to advocate for yourself or your loved ones by having this information and knowing, hey, if Medi-Cal denies them for spousal impoverishment rules, you know that's not true. They should be able to get the benefit and then can advocate for themselves. Next slide, please. Okay, so let me go back. Now I'm going to switch over to in-home supportive services. So as I mentioned, to get in-home supportive services, you have to qualify for Medi-Cal. You have to be a California resident. And what that means is you're just living in California. There's no timeline as to how long you've been here. You just have to live in California and have the intent to stay. You have to live in your own home. That just means in the community, your own home, family member's home, apartment. You have to be aged over 65, disabled, or blind. And most importantly, you need to have someone help you with your activities of daily living, like bathing, dressing, or need help with cooking and cleaning. If you need help with these different kinds of services, you can qualify for in-home supportive services. A doctor must fill out the in-home supportive services physician form in order to qualify you for in-home supportive services. When you apply for IHSS, they will send you the doctor's form to give to your doctor to complete. Next slide. So the way this program is set up is a little bit different than you may expect. What happens is when someone applies for in-home supportive services and they're eligible because they have Medi-Cal, IHSS will send a social worker, an eligibility worker to your home to evaluate you. Based on that evaluation, the social worker will send a letter in the mail called a notice of action. And that notice outlines how many hours you get a month. It can be anywhere from 1 hour a month to a maximum of 283 hours a month. So let's say IHSS assesses you and you're given 100 hours a month. Then it's up to you to find your provider. The provider does not come from an agency. You need to find your own provider. It can be a family member, it can be a friend, it can be a neighbor, it can be a private provider, it doesn't matter. It can be your spouse. Okay. IHSS assigns the hours, you find the provider, you manage the provider, you train the provider, you fire the provider, and IHSS pays the provider. Okay, that's the way the program works. Now, most providers, I think about 80% of providers in this program are family providers, but you can also hire a private provider. I know people often have trouble finding private providers. The IHSS program pays the provider $15 an hour. There is an agency called Personal Assistance Services Council. They work in coordination with in-home supportive services. And they have a list of providers that are able and pass a background check to work for IHSS, so you can go to them and get some names. Next slide. Also understand when you apply for IHSS and Medi-Cal, these are different application processes. When you apply for Medi-Cal, they don't tell you about in-home supportive services. Unfortunately, you apply for IHSS for a different number. There's different people making the decisions about eligibility, and there's different assessments. As I mentioned, IHSS comes out and does an assessment after you apply the first time, and then every year they will come out and reassess you. The same thing with Medi-Cal. Every year you have to complete a Medi-Cal redetermination form to see if you're still eligible. But that doesn't mean they're at the same time, these two reassessments. And also Medi-Cal and IHSS, they don't really communicate with each other. So you'd have to work with each agency on your own. Next slide. So I talked a little bit about you have to live in your own home. So you can live in a house, an apartment, a hotel, or motel, but you cannot get in-home supportive services if you're in a nursing home, or if you're staying in the hospital, or if you're in an assisted living facility. Next slide. Just a little IHSS trivia here. I did mention earlier what the maximum IHSS hours are. Do you remember? The maximum IHSS hours are 283 hours a month. Now, IHSS assesses each individual. So the hours will vary based on each individual's needs and situation. Can IHSS hours be used in the workplace? Yes. So this IHSS program provides for care at home or in the workplace. And the last one, can IHSS hours be used at college? Yes. Children can have IHSS. Anyone from newborns to as old as you can imagine can have IHSS. It runs the spectrum. And if there's an adult with a disability going to college or university, their IHSS hours can be used at college. Next slide. So in order to get IHSS, there has to be a need that that person cannot remain safely in their own home unless IHSS services are provided, and a doctor does complete the verification for the need for IHSS services. The IHSS social worker, when they come to the home, they will do a full assessment. They look at the recipient's living environment, and they also look to see if that recipient is getting services from other providers. Are they getting services from a daycare provider, from Meals on Wheels, from their school? Also, they evaluate how much can the person do on their own and how much help do they need to take care of their personal needs and other needs. Next slide. So I want to explain a little bit more about how IHSS computes the hours. IHSS will send a notice of action once you apply, and it'll have an outline of all the hours that the person receives. Now, according to the IHSS regulations, IHSS only pays for certain service areas, and most of these service areas are written on the notice of action. And then it'll have how much time the person receives for each service area, like dressing. Maybe that person receives 2 hours a week for help with dressing. Feeding, maybe the person receives 3 hours a week for help with feeding, and so on. But they use this secret assessment tool. It's secret because it's not on the notice, so you don't see that it's actually being used to calculate hours. But let me explain how it works. Next slide. It's called the functional index ranking. So this ranking helps IHSS decide how many hours you get in a certain service area. The IHSS social worker gives you a rank for each service area that you need help with. Next slide, please. So this is how they assess your rank. So let's say I'm taking care of my mother, and she has Alzheimer's disease, and she needs help with a lot of different kinds of things. If she's a rank 1, for example, in feeding, that means she can feed herself independently. She doesn't need any help. If IHSS says she's a rank 2 or assesses her as a rank 2, that means she needs some verbal cues, verbal reminders. Let's say for eating, sometimes she forgets to use a fork, or sometimes she needs to be reminded to slow down and not eat so fast. So I say, Mom, hey, use your fork. Hey, make sure you use your fork. Or Mom, maybe you should slow down a little bit. Those are verbal cues. That would be a rank 2. Rank 3 is she needs some assistance with feeding herself. So let's say some days she can feed herself, but on bad days, I need to actually feed her physically for part of the meal. Rank 4 is she needs a lot of assistance. Like, I have to feed her most of the time, but she can eat finger foods on her own. And rank 5 is she cannot perform the service at all. She cannot feed herself, and I must feed her all of the meals, give her all of the water, all her drinks. So based on the rank, IHSS will assign a certain amount of hours. The hours can, well, go to the next slide, and I think it'll be easier to understand. So these are the hourly task guidelines. These are guideline amounts of time for how much IHSS, how much time IHSS can grant in each service area. So why don't you look at the bottom of this, and you can see for the category of bathing, oral hygiene, and grooming, if someone's ranked a rank 2, which means they need verbal cues to complete the task, IHSS most likely will assign 30 minutes a week to an hour and 55 minutes a week for assistance with bathing, oral hygiene, and grooming. If the person is totally unable and needs total assistance to complete the task, they're a rank 5, and they'll probably get somewhere between 3 hours a week for bathing, oral hygiene, and grooming, up to 5 hours and 6 minutes a week for this service. Now, the IHSS hours in each service area can be higher than the guideline amount or lower than the guideline amount. Okay, these are only guidelines. So if someone needs special care, they can be an exception to the guideline amount. So let's talk about bathing. I take care of my mom, and she has dementia, like I said. Now, she is super combative, and she hates to take a bath. And I know many people with dementia have this behavior. She hates to take a bath, but also she's incontinent, and she needs to be bathed at least once a day. So it takes me a really long time to help my mom get bathed. So I can ask for an exception to the guideline for more than 5 hours and 6 minutes a week because her condition justifies an exception. So just be aware of that. These are guideline amounts. You can get any amount of time in each category as long as you can justify the need for additional services. Next slide, please. As I mentioned, there's no time limit for any of these service areas, and there can always be an exception. Someone could get more time than the guideline or less time than the guideline. These are only guidelines. Next slide. So this is what a IHSS Notice of Action looks like. It's a long sheet of paper. It's like legal size, and it lists all the categories that someone can get service hours in, or almost all the categories. Next slide, please. I want to talk specifically about a benefit called protective supervision. Protective supervision is an IHSS service for people who have a mental impairment and need to be watched to make sure they don't do anything dangerous. Okay, so it's kind of like babysitting. It's a covered benefit. So if I'm watching my mom and she has Alzheimer's disease and she doesn't know she's doing something dangerous, let's say she wanders out of the house, but she doesn't know her address, she doesn't know how to use a phone, and she sometimes forgets my name. So if she gets lost, there's no way for her to find her way home. That would be very dangerous. And I have to watch her to make sure she doesn't leave the home. Or maybe she tries to cook and starts fires because she forgets that she's cooking. Or I had a client once, he would spray bleach on fruit to try to clean it. And that's very dangerous. So if someone has a mental impairment, it can be dementia, it could be a mental illness, it could be a developmental disability, it could be a brain injury. It doesn't matter. As long as there's an impairment and they're able to engage in dangerous behaviors, they may be eligible for this special benefit called protective supervision through the InHome Supportive Services program. Next slide. In order to get protective supervision, the person must meet certain requirements. They have to have a mental impairment, like I just talked about, and they have to be non-self-directing. What that means is the person does not understand that the behaviors they're engaging in is dangerous. Okay. Um, like I had a client once, she put a metal fork in the microwave. She didn't understand that that's dangerous. It'll cause a fire. So they have to have a mental impairment and be non-self-directing, and people have to be engaged in potentially dangerous behaviors. It doesn't mean that if someone's bedbound, they can't get protective supervision. If someone is bedbound, they still can get protective supervision. I had a client who was, gosh, she was in her late 80s. She was a tiny little woman. She weighed about 90 pounds, and she was couldn't walk anymore. Her legs would not hold her up, and she had an advanced dementia. But in her mind, she thought she could walk. So IHSS denied protective supervision, and we assisted the family in trying to get it. I went to the home when IHSS did an interview with her, and the social worker interviewed her and said to her, what do you do during the day? And she said, oh, I get up and I walk to the market and I do the shopping. Well, she had done that when she was younger, and she thought she could still do that. In reality, she did try to do that. She tried to get out of bed and she would fall. The family had a pad on the bed. It was an alarm pad. So whenever she pushed herself up to get out of bed, an alarm would ring. The family would run in and make sure she stayed safe in bed. And they also had cameras in the room to watch her. So even though she couldn't walk anymore and she was bedbound, she was still able to engage in a potentially dangerous behavior, which the behavior was getting out of bed and falling. There has to be a 24-hour need for supervision. So if someone only engages in dangerous behavior, maybe during sundowning from 4 to 6 p.m., then they're not going to be approved for protective supervision. There has to be a need 24 hours a day. You never know when it's going to pop up. That would meet that criteria. And most importantly, there has to be a 24-hour care plan. So there has to be someone with the individual 24 hours a day in order to get protective supervision approved. So as I said, the maximum IHSS hours are 9 hours a day. So that leaves a lot of the time each day unpaid for by IHSS. So the IHSS program is not a 24-hour care program. It does provide some care, but there are also still a lot of gaps that either a family caregiver or a paid caregiver would need to fill in order to get the IHSS protective supervision approved. Next slide. I did just talk about IHSS having gaps in, it's not a 24-hour care plan. There are often service gaps. There is another Medi-Cal program that provides more care hours on top of IHSS hours. Next slide. It's called the Home and Community-Based Alternatives Program. So Medi-Cal has a lot of different programs. So once someone gets Medi-Cal, they're able to access a whole bunch of additional programs. This program provides home care based on the person's medical needs. Usually people in this program get at least 300 hours or more of combined IHSS and home and community-based alternatives time. This program also pays for home modifications to make sure the home is safe for the individual. It provides RN care, LVN care, social worker, and other professional care. You would apply for this program at your local HCBA provider. These are the providers for LA County. You can call any of those providers and get an application for the wait list. You can also find the applications online. There is a wait list for this program. I can't tell you how long it is. It varies from 6 months to a year or more. So I encourage you to get you or your loved one on the wait list for this program. You do not have to be on Medi-Cal to be on the wait list. So you can go ahead and enroll in the wait list and then apply for Medi-Cal or apply for Medi-Cal at a later date. So just be aware of that. It's a fantastic program. It's another secret program. Nobody tells you about it, but it's a great program for people that need home care, want to stay at home and avoid institutionalization. That's the whole point of this program, is to allow people the choice to stay at home instead of going to a nursing home. Next slide. These are some IHSS resources. We have a book called the IHSS Companion. It goes deeper into how IHSS assesses services and ways to advocate for an increase in hours. It's on our website and available in 6 languages. There's also a more technical guide called the IHSS Guide for Advocates by Justice and Aging. Disability Rights California has all kinds of publications on IHSS. And this ACIN is a very technical directive from IHSS about how they compute hours if you want to go real deep into how IHSS calculates hours. I want to mention a couple other Medi-Cal benefits that may be beneficial to you or your family member. I talked about in-home supportive services, which pays for home care. I talked about the home and community-based alternatives waiver that also pays for more home care and other kinds of licensed professional services. There's a program called Adult Day Health Care. Medi-Cal calls it CBAS, Community-Based Adult Services, which is it's an adult daycare center. So Medi-Cal pays for adult day health care as part of the Medi-Cal program. This allows your loved one to go to it's a day healthcare facility. They often provide transportation to the center. There's medical staff at that center. They provide social services at the center, activities, lunch, and it helps to give caregivers a break. So your loved one can go to that facility for a couple days a week, every day, 5 days a week for maybe 3 to 5 hours or however long that program offers services. It's a great way to get a break. You can have in-home supportive services and the adult day health care. So Medi-Cal has lots of resources and care for people enrolled in the program. And you can kind of cobble these programs together to get the coverage that you need to keep your loved one at home. Next slide. Well, I know no opportunity for questions, unfortunately, but here's my contact information. You're welcome to give me a call or shoot me an email, and I'm happy to discuss your family situation with you, or if you have any questions about this presentation. I really welcome the opportunity to speak with you today, and I look forward to hearing from you, and I appreciate you giving me your time. Thank you.
Thank you, Kim, for that informative presentation. Many family caregivers do not know about in-home supportive services and how it can be used to help their caregiving situation. It is such a useful benefit for families to take advantage of, and we are glad to be spreading the word about it today. Thank you for joining me today as we learned about Medi-Cal and IHSS. And a very heartfelt thank you to Kim for her wonderful presentation. As I mentioned at the beginning of this video, the USC Family Caregiver Support Center is here to help educate you, connect you to resources, and support you throughout your caregiving journey. Please be sure to visit us at www.fcsc.usc.edu or visit our social media pages on Facebook, Twitter, and Instagram to learn more and connect with our center. Now, if you enjoyed this video and found it helpful, please help us by clicking like below this video. Also, make sure to click on the red subscribe button, also below the video, to subscribe to our YouTube channel and be notified every time we post a new educational video for the caregiving community. Take good care of yourself, and until next time, just remember that caregivers fight on.